Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Jennifer Hebert, Executive Director of Magnolia Community Services, which provides support to adults with intellectual and developmental disabilities. And in recognition of National Autism Awareness Month, we'll be joined by Autism's Society of Greater New Orleans board member, Dr. Hanna, who will tell us about their work and their upcoming 13th Annual Autism Awareness Festival on April 22nd. And joining us for today's Eat Fit NOLA cooking segment, we'll be in the kitchen with Amy Davis of Swegs Kitchen and Eat Fit NOLA Ambassador, Emily Eickhoff. So don't go away, we'll be right back with more Community Health Heroes.
I'm a retired school psychologist, and helping people was my thing.
I was very independent and thought I could take care of myself. I fell and I had to have Meals on Wheels.
After my stroke, when Meals on Wheels started, I was on the other end of the stick, so to speak.
Meals on Wheels coming to my door as someone who's housebound, having someone check on me, assures me that I'm not forgotten.
Meals on Wheels has given me a mode of freedom that I wouldn't have otherwise.
We're the clients.
We are the clients.
We are the clients of Meals on Wheels.
America, let's do lunch.
1 in 6 seniors faces the threat of hunger, and millions more live in isolation. Drop off a hot meal and say a quick hello. Volunteer by donating your lunch break at americaletsdolunch.org.
Welcome to the Community Health Heroes Show. Did you know that about 1 in 6 children in the United States have one or more developmental disabilities or other developmental delays, and that people with disabilities represent the largest minority in the world? Joining us today to tell us more is Jennifer Hebert, Executive Director of Magnolia Community Services. Welcome to the show, Jennifer.
Thank you. Nice to be here.
Can you tell me a little bit about Magnolia Community Services?
Sure. We were founded in 1935 by Dr. Charles Bloom as a school for children. He and his wife had a son with a developmental disability, and of course, in 1935, there were no educational opportunities for those kids. So he started Magnolia with a group of local businessmen as his board of directors, and it has grown over the years and evolved, and so now we serve over 250 adults every day with developmental disabilities in various programs. We've got a residential program which includes group homes as well as supported living apartment homes. We have a vocational program which includes day habilitation, supported employment. There are lots of volunteer job opportunities for our people. We also provide respite and PCA services for families who just need a break.
So when somebody does use the respite services, does a member come to your home, or do you guys go to their home?
Generally, our staff would go to the individual's home, or just maybe even take the individual out on an outing of their choice to give the family some rest in their home.
Absolutely.
Yeah.
No, that's a great service.
Yeah.
And do you still have a school on site?
We do not. That merged into the Jefferson Parish Public School System long ago. Right. So all of the people that we serve are at least 18. Most of them stay in the school system until age 21 or 22, and then we'll help them, figure out if they want to work or whatever option they choose.
And how many people actually are living on the property?
On the property, we have 5 individual homes, which are run like your home or my home. Those guys generally have more intensive medical needs. The other guys live out in the community, either in an apartment or a group home, and they are fully integrated with everybody else.
And you support them. And can you tell me about how many people in Louisiana have a disability?
Generally, about 2% of our population is diagnosed with a developmental disability. That is what is recorded and what we know about. There are certainly people who do not seek services or receive a diagnosis.
And why is it so important for our community to get involved in donating to services such as Magnolia?
Well, to provide the caliber of services that we choose to provide, we're not fully funded by the state of Louisiana, so fundraising is what we use to bridge that gap.
Do you have any fundraiser events coming up?
Actually, we just had one last week in our annual Magnolia Fest, and on November the 4th, which is the first Friday of every November, we have our annual gala, and it's on our grounds.
Jennifer, if you had a wish list for Magnolia Community Services, what would be on that list?
Well, actually, we have a wish which is happening right now, coming true. We've received initial donations for an outdoor music garden, and so we're actively fundraising in order to complete that project. And what that entails is a 50 by 120 tract of land that's going to be dedicated garden space with outdoor musical instruments. And so what that's going to provide for our people and for the community is park space, green space, and the ability to just get extra exercise. We'll have a walking path throughout, and dabble in instruments that'll be outside for all to enjoy.
What kind of instruments can be placed outside?
There are huge drum sets, there's xylophones, there's all different kinds of African instruments that we're looking into, and there's lots of information on our website about that as well, and how people can sponsor instruments or any part of the park that they wish.
Oh, that's really cool. And so the residents and the community can enjoy that.
Yes.
Anything else on your wish list?
We're always seeking to better our programs, and so any donation that we use goes straight into those. And it's our mission to make life the best it can be for everyone we serve.
And how do we find out more information on either how to volunteer or donate or find out more information about your fundraiser?
We've got all that on our website. That's mcs-nola.org.
Okay, that's awesome. Well, I so appreciate you coming on the show today and providing this valuable information.
Thank you. It was great to be here.
Thank you, Jennifer. When we return, we'll tell you about a very important community event that you and your family can support. So don't go away. We'll be right back with more Community Health Heroes.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to Community Health Heroes. April is National Autism Awareness Month. Did you know that more children will be diagnosed with autism this year than with AIDS, diabetes, and cancer combined? Joining us today is Dr. Hanna, Director of Research and Development, Autism Spectrum Therapies, and Autism Society of Greater New Orleans Board Member. Welcome to the show, Dr. Rue.
Thank you so much for having me.
So can you tell me what is autism or autism spectrum disorder?
Sure. Autism spectrum disorder is actually affects about 1 in 68 individuals in the United States, and it is a neurodevelopmental disorder. So we're talking about a brain-based disorder, which really impacts an individual's life in many different ways. So some of the diagnostic characteristics include difficulty communicating. So we have a number of individuals who have difficulty with verbal communication, a lot of individuals remaining nonverbal. We have a number of individuals diagnosed with autism who have difficulty interacting with the social world around them. So picking up on those subtle social cues that maybe you and I would be able to recognize pretty quickly can be a challenge for individuals on the autism spectrum. Finally, a lot of individuals struggle with repetitive behaviors and restricted interests. And so we're talking about hand flapping or body rocking and restricted interest, which may take up most of their day. So talking about preferred topics like trains or a television show, which can be challenging for the rest of the social world to try and interact with an individual who's focused on something.
Absolutely. Absolutely. So how can you tell if an individual has autism or autistic spectrum disorder?
So right now we can provide a reliable diagnosis at 18 months of age. So we're talking about some very young children. And I usually tell parents to look for signs such as no babbling or pointing prior to 12 months of age, no single words by 16 months of age, and then lacking eye contact and joint attention, so pointing out something fun if your child or toddler doesn't follow that point. That's usually a red flag that there's something else that's going on.
And what do you recommend if you notice these things in your child?
I usually recommend to go straight to your pediatrician. There's also a fantastic resource that's freely available, and it's MCHAT, the Modified Checklist for Autism in Toddlers. You can access that at mchat.org. It's 20 yes or no questions that you can simply go through. It's a screener for autism or developmental disabilities. You take that information to your pediatrician and you can review that together to discuss your concerns.
That's wonderful to know. Great information there. And then are more boys or girls diagnosed with autism?
We see boys 4.5 times more likely to be diagnosed with autism. Now that being said, girls are just as impacted by the diagnosis as boys, but we do see more boys, and that may speak to the genetic factors that we're identifying as being causes of autism.
If you know, is there anything you could do to prevent autism at this point?
Not at this point. What we know is most important is early identification and early intervention. So again, if you have concerns about your child's development, speak to your pediatrician and learn what you can do in order to access community resources in order to help your child develop in communication, social skills, and the like.
Absolutely. So you have a wonderful event coming up, your 13th annual Autistic Festival. Can you tell me about that?
Yes, so the Autism Society of Greater New Orleans, ASGNO, is hosting the 13th annual Autism Awareness Festival. And we're going to have that on April 22nd. That's a Saturday from 10 to 1 with registration opening at 9:30 in the morning. We have some fun stuff for kids and adults. So we have a bounce house, arts and crafts activities for the kids, fun games. Participants can include adults, but for the adults we do have a silent auction, resources, as well as vendors who will have some items available for families impacted by individuals with autism.
And where is this taking place at?
This will be at the First Baptist Church in New Orleans, and that's on Canal Boulevard.
And you said it's on April 22nd?
April 22nd from 10 a.m. to 1 p.m. Oh, food, drink, and music too, as is required in anything in New Orleans. Yes, absolutely.
And if our community wanted to find out more information about the society, where can they go for that information?
Our website is asgno.org. You can also email us at info@asgno.org, and they'll have all the information there.
And if they called you and they had a child with some autistic characteristics, what kind of services are provided? Or can you direct them to?
Yes, so ASGNO is a community resource. You can call with questions about diagnostics or community services. We have a list of resources available, so a number of different agencies, including the one that I work for, that provides home-based services, clinic-based services, as well as going to schools and communities.
And providing resources for the schools and communities.
Absolutely. ASGNO also has community events around art activities and various interests for families who do have a child with autism.
And if you had a child with autism, a lot of times they end up having an individual education plan. Do you provide support for that too?
Well, yes. So we do have resources that are available, and we can also point you in the direction of reliable websites. Things like rightslaw.com is a fantastic website for parents to visit to be informed about their rights on the federal level as well as on the state level. And again, asgno.com will have information as to where to access those things, or you just give us a call and we'll point you in the right direction.
Dr. Rue, what challenges can a parent expect as a child transitions to like adulthood and possibly entering the workforce or college or both?
So I usually tell parents to start preparing while the child is in high school. And so there's typically a transition period where you start to identify your young person's interests. And if that young person is able to vocalize their interests and their goals and objectives, then you certainly want to get them started on that track early. As autism is a spectrum disorder, we have individuals who need lots of support, 24-hour care, but we do have individuals on the spectrum who can go to college and graduate school and be very successful in the business world. So it depends on the individual's needs, and you want to start that probably about age 14. Once they go into college, there are many universities now in the United States who have programs and supports for individuals, and many workplaces now are open to the idea of having an individual on the autism spectrum. Of course, it's always great to find new places and opportunities for individuals, so advocacy and education remains one of the most important things that we can do as a community advocate for individuals on the autism spectrum.
And isn't there even a program that will support an individual with autism as they move into the job force to maybe educate like the employer group on what to expect?
Yes, in various states around the country, including Louisiana, there are agencies that are available. And again, if you contact asgno.org or give us a call, we'll be able to put you in touch with those organizations that can provide vocational trainers, that can provide advocates that will go to the work site and assist that individual and the employer in understanding what the needs are and how an individual with autism can contribute to the workplace.
Because they can be very, very hard workers. I know several employer groups are actually looking for autistic children and adults to work for them.
Absolutely. So what's fantastic is if that individual on the autism spectrum identifies their desire to participate in whatever it may be. It might be office work, it might be computer coding or something like that. They're as passionate as anybody about what they want to do, and so they can be a real attribute in any workplace.
Well, thank you so much for providing this valuable information. It's really important to our community.
Thanks so much for having me.
When we return, we'll be in the kitchen with Amy Davis of Swegs Kitchen, so stay tuned for more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Welcome back. Joining us today in the kitchen is Amy Davis of Swegs Kitchen and our good friend Emily Eickhoff of Eat Fit NOLA. Welcome to the show, ladies.
Thank you for having us.
So what are you preparing for us today?
So today we are going to be making a Sonoma chicken salad from Swegs Kitchen. It's a really, really delicious salad, lots of nutrition packed into it, and a nice hearty size.
And lots of color.
Beautiful color, yes.
So tell me what's in the salad.
So we have some mixed greens here, some delicious gala apples, tomatoes, and then this is what we call our roasted roots. It's roasted beets and carrots, and there's a little bit of onions in there, lots of herbs and spices. And then we have some walnuts, some goat cheese, some apple balsamic vinaigrette, some nice grilled chicken, and then fresh basil.
The basil smells delicious.
Yeah, it all smells so good.
So how many calories is in this?
So it's an entree size salad, so it's about 500 calories. You know, you're getting your calories from your chicken, your goat cheese, your nuts, your dressing, and then of course all your fresh fruits and veggies. And then it's also really a great source of protein, so great meal option for you here.
And if you were either vegan or you wanted to substitute the chicken, say you wanted a different protein, what could you substitute the chicken for?
You could do, if you're a pescatarian, you could do salmon or tuna. If you want to go all the way vegan, you know, we have avocado, we have other nuts that, you know, you can easily substitute out that cheese and that chicken if you want to make it a completely vegan, plant-based meal.
And how did Swegs and Eat Fit NOLA partner together?
So Swegs and Eat Fit NOLA have always kind of worked together. Molly Kimball, the founder of Eat Fit NOLA, has been a part of Swegs since conception. So we have a ton of Eat Fit NOLA items on our menu. We do the barbecue shrimp and cauliflower grits together with Eat Fit NOLA in the Superdome, and next in the baby cakes stadium.
We're at the Shrine Stadium.
The Shrine Stadium. Yeah, so we do a bunch of events together. We'll provide food sometimes for, you know, various things that y'all got going on. So we're a great partnership, and, you know, we love to work with Eat Fit NOLA.
We love you too.
Well, let's go ahead and make the salad, and then I have a few more questions for Emily.
Okay, so it's super simple. We've got all of our ingredients all laid out here. So this is about 3.5 cups of lettuce. Wow. So yeah, nice good serving of green leafy vegetables here.
You will not be hungry if you finish that.
No, you are not going to be hungry. I usually don't even finish the whole thing. So next we have our gala apples, and these we just chopped up. You know, tomatoes, good source of lycopene here. Our roasted roots.
And is the salad available year-round?
Yes, it is. It is. Walnuts, add a nice little crunch there. And then goat cheese. So goat cheese is actually a little bit lower in sodium than feta or some other cheeses.
It's a lot lower. I think it's about 3 times lower.
Yeah.
Wow.
Crazy. You save a little salt there. Right, exactly. And for some people, it's a little bit easier to digest as well. So I'll add the chicken next. So we actually slice this chicken up for you. This is just lean chicken breast, and we do a little salt and pepper on it. We bake it in the oven. We'll add some fresh basil. Usually do about 2 leaves, 2 tablespoons, something like that. We just break it up like this.
So it's very, very colorful. I mean, it's just
so
bright.
So fragrant. I mean, and that fresh basil taste is amazing. It's nothing like dried basil. Getting that fresh basil in there is great.
So Emily, tell me about the growth and expansion with Eat Fit NOLA.
Yes, so we have some really exciting news. We are actually launching at Shrine Stadium with the baby cakes. So just as we are in the Superdome with the Saints, we're expanding to the baby cakes and going to be at all the baseball games there as well. So you can find, and it's actually Swegs who does the meal. So they do our shrimp and cauliflower grits, our tuna salad, and our chicken wraps, things like that.
Is it the barbecue chicken sliders with the coleslaw on top? So delicious.
So whatever kind of sport you're into, you can pretty much find us anywhere between basketball, football, baseball, we're there. And then we're always onboarding restaurants. Currently, we have about 5 that we're working on, and we have about over 100 restaurants now.
It's up to 100?
Wow. Yes, so between Mandeville and New Orleans, we have about that many restaurants. So
wow.
And even more in Baton Rouge and Houma Thibodeau area. So
you're really
very
expanding.
Exciting. Yes.
Oh my gosh, because I remember it was like 30, and then it was 50, then it was 60, now 100.
Yes, 100.
That is amazing. Oh my gosh. Yeah. And Swegs is growing in leaps and bounds too. Can you tell me a little bit about that?
Yes. So last time we were here, we were gearing up for football season with the Saints, serving our barbecue shrimp and grits in the Dome with Eat Fit NOLA. So we'll be there again next year, but we're also we're open in Mid-City now. This is our menu. It's a quick service style restaurant, so you can go in, place your order, get it in 10 minutes or less. We also have tons of grab and go options there, and we're building another quick service style restaurant on Veterans Highway in Metairie, so that should be open soon. And yeah, we're always working on new projects. We're on Waiter and Uber Eats, so if you want your food delivered to you, you can just download those apps and get some food from there. And then we also deliver ourselves. We deliver meal plans and our individual meals through our lifestyle program called Swegs Lifestyle Advantage. So yeah, we're just trying to make New Orleans a healthier place, make our food as accessible as possible.
So you have 5 locations, you have takeout, you have delivery. That's amazing.
Yes, so it's a lot of fun. We're always, moving really quickly and, trying to do new things. So
if we want more information about Swegs, where would we go to get that?
You can visit our website at swegskitchen.com or swegslifestyle.com. You can find us on Facebook, Instagram, we're on social media, and that's just Swegs Kitchen. And yeah, look out for us. We're in Natural Awakenings magazine, and of course here on Community Health Heroes.
And Emily, what if we want to find more about Eat Fit NOLA?
Yes, so you can always go to our website, eatfitnola.com, or you can download our free smartphone app. It's Fit NOLA by Eat Fit NOLA app. It's completely free, and you can find all of our partners, including Swegs, on there and all of the Eat Fit options there.
There's some recipes there too?
Yes, we have a ton of recipes, a ton of great shopping lists, just great resources on that app.
That is awesome. So tell me a little bit more about festivals and Swegs involvement.
Yeah, so festival season is upon us. We're doing, lots of celebrating, lots of indulging, but Swegs can definitely play a part in helping you balance that lifestyle. We're in Mid-City, so for Jazz Fest, for any other festivals in the Mid-City area, we're happy to provide you with a breakfast or a lunch before or after, so that you're getting a nice healthy meal, staying hydrated, and just helping you keep that balance between nutrition but still having a fun, good time here in New Orleans.
Maybe you can just pick one bad food at the festival.
Right, exactly. Pick one, indulge in it, enjoy it. I mean, for me, it's crawfish bread. I don't know about y'all, but it's delicious. But no, so a nice big salad like this before or after is a great nourishing meal for, to fuel you for your day and your fun.
And you'll be tempted less to cheat after you've eaten this whole salad.
Exactly, because it's huge and it's delicious and packed with nutrition.
Thank you both for being on the show today.
Thank you for having us, as always.
And we'll be right back with more Community Health Heroes.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
Hey, Hard, what's this? That's my resignation. You're resigning? Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find us on YouTube. We hope that the information we provided today has helped you and your family live healthier and happier lives. I'm Dr. Penny Walker. Join us next time for more Community Health Heroes.